My name is Derrico. I'm one of the co-founders of Utiva, which is a Canadian brand. So we're a Canadian company, launched about 3.5 years ago. Our brand of Utiva is focused on natural UTI prevention. The talk we're going to be doing tonight is about natural UTI prevention and how to build patient trust and repeat visits in the pharmacy world. We also have a guest speaker, Colin Holyk, and he has a pharmacy out in BC who has been working with us and using Utiva over the past almost 2 years or more. And he's going to tell us a bit about his experience and how he came to know about Utiva as well. So he'll be coming on in about 15-20 minutes or so, and I'll be doing the first part of the talk here. So just quick agenda, we're going to do a quick overview of who we are, a review of UTIs, talking about treatment and prevention guidelines. We'll introduce you to the Utiva products, which many of the pharmacies or the pharmacists here have Utiva products in your stores. And we're going to have a chat with Colin about his experience as well, followed by any Q&A that anyone has here and the raffle right at the end, which we promise we have two $150 Amazon gift cards that will raffle out at the end, but you got to be present here to accept the prize. So we hope everyone hangs out until the end. So Utiva is a brand created by Xyle Plus, which is our company. It's everything we try to do is simple, natural. It's backed by science. We are a small business that started up about 3.5 years ago. We've worked with a number of accelerators and business support groups such as Mars or Bioenterprise, if any of you are familiar with them. Faraz, who's also present here, is my co-founder, and the two of us started the company, as mentioned a little bit ago. Faraz, you can say hi.
Hi, everyone.
And we both come from the medical industry. So we've both worked in like the pharmaceutical and the medical device world and left to branch out and start this business on our own here. And one of the main efforts for us and what we're trying to do is improve patient health from a holistic point of view. Now, we obviously work with medical experts. Some of these are just a couple of the clinical advisory team that we have. Colin McDermott, for example, is a urogynecologist out of Mount Sinai. Dana Rice is a urologist down in the US, and Leslie Carr on the top right is a urologist as well out of Sunnybrook Hospital in Toronto. YC is one of our scientists who helps to formulate our products. So quick look at a review of UTIs. And you know what, I'm probably preaching to the choir here because I'm sure everyone that's in attendance has seen a lot of UTI patients come into your pharmacies. It's probably one of the more common reasons that people do go to the doctor because of their acute or recurrent UTI infections. So the bottom line, what is a UTI? It is an infection that could impact the kidney, but it impacts the ureters, the bladder, and the urethra. Most of the infections involve the lower urinary tract, which is the bladder and the urethra. This is often where that sense of urgency to pee or that burning sensation does happen as well. Women in general are at greater risk of developing a UTI. Even from our customer base, approximately 90% of our customers are female, 10% are male, so it does impact the men. But one of the reasons for the female is that it's the shorter urethra, so there's a higher chance of bacterial introduction into that lower urinary tract anatomy. Not only that, during the later stage in life, postmenopausal, due to hormonal changes as well, women that are postmenopausal are more susceptible to getting UTIs. This graph on the right here, not the graph, but this illustration on the right does give us a look. This is what the US looks like. Canada is very similar in terms of what type of bacteria is usually causing the UTI. Majority of it is this green color here, which is E. coli, followed by Klebsiella pneumonia and Enterococcus, and staph as well, staph and Enterococcus species. So those are the most common ones, E. coli leading the way as the most common bacteria that is culture identified in their UTIs. Common UTI symptoms include burning with urination, frequency of urination, and even blood or cloudy or strong smelling urine. There's lots of causes. The use of catheters is a big one. I'm sure everyone here has patients that use indwelling or intermittent catheters. There's always a possible introduction of bacteria. Sex is one. Sex-associated UTIs is definitely a factor. as well as just basic things like dehydration, even birth control pills, or not on the list there should be, but postmenopausal and hormonal changes can be a cause as well. Couple statistics in Canada, pretty much the annual visits are approximately 1.64 million women over 25 years old visit a doctor for a UTI every year in Canada. Hospital-acquired infections is also pretty predominant, which is about 7.9% in 2017, of which 32% of hospital-acquired infections were actually UTIs. They're very common and actually one of the top 3 reasons why antibiotics are actually prescribed. So guidelines. 2019 was a big year in terms of research leading towards the modification and the introduction of management of recurrent UTIs. So the AUA, which is the American Urological Association, and the CUA, Canadian Urological Association, both introduced recurrent uncomplicated UTI guidelines for women in terms of how to prevent and how to treat. So 2019 was a big year in terms of taking that step forward and looking at all the data that was available to see what works and what doesn't work. The bottom guideline here, which is the Mum's Health, this is a specific Canadian guideline that was also updated in 2019. This is a very common book for family physicians or GPs in Canada, and it also calls out the like updates in terms of antibiotics or natural prevention as well. So looking at the AUA and the CUA guidelines, again, when it comes to treatment for UTIs, antibiotics are the main treatment. It's a first-line therapy. It's needed to kill the bacteria pretty much, and kill the infection and kill the bacteria in doing so. Now, one of the main important things about this first-line therapy with antibiotics is that, you know, without destroying that bacteria in the first place, it's that lingering UTI could always continue to be there. And that's where the evidence lies in to make sure that we treat with a proper antibiotic as well. And the way to do that is to actually consider it to be a culture identified bacteria. So once they do that culture and they identify what that bacteria is, using the right antibiotic, that can help kill that particular bacteria. Now, when it comes to antibiotic prophylaxis, I'm sure all of you have seen this as well. Basically, this is a daily antibiotic for a set duration of time because someone is so recurrent or has that many frequent UTIs. Now, this is, again, grade B level, which is, you know, it's highly recommended, and a lot of patients end up on this. I'm sure everyone here has seen that. It's usually a low dose antibiotic catered towards that type of bacteria that's been identified by culture. And patients are put on this for, it could be like a month up to 6 months. We've seen even longer, but we also know the risks associated with long-term use of antibiotics. So how do antibiotics work? Basically, there's a variety of mechanisms of how they work, but basically they're looking at inhibiting the cell wall synthesis so they cannot proliferate. They're looking to damage the cell membranes, inhibition of protein synthesis, interference with metabolism of the bacteria, and impairment of the nucleic acids as well. So bottom line is you need an antibiotic to kill the bacteria. UTIs are also known to kind of clear on their own, but that's only approximately 40% of the time that a UTI can clear on their own, but your symptoms are going to be severe for the patient still, which is why almost 100% of the time, an active, acute, or recurrent UTI is actually given an antibiotic regardless. Reduce the symptoms as well as tries to make sure that you're, just in case you're one of those that cannot clear it on your own. So they want to be sure. A complicated UTI that extends and actually, you know, is not treated or killed properly can actually end up in a kidney infection, which could end up with the patient being in the hospital. Common side effects to antibiotics. I'm sure everyone here has also seen like patients that have side effects to antibiotics, but fungal infection is one of them. One of the main ones, though, that we see talked about is antibiotic resistance, and how many patients are not responding to different antibiotics and they constantly have to be changed. With what we're trying to do with prevention, it should help in terms of reducing the number of infections and therefore reducing the need for antibiotics, which can help with antibiotic resistance. So non-antibiotic prophylaxis. So this was now included into the guidelines. And the only non-antibiotic prophylactic option offered in the guidelines is actually cranberry prophylaxis. And within the cranberry, when you look at the details that they talk about, it actually talks about a proposed mechanism of action that is thought to be related to the proanthocyanidins or PACs, which are present in the cranberry, because the PACs are what have the ability to stop bacteria from sticking. So natural prevention with cranberries in this sense are not actually killing the bacteria, it's stopping it from sticking, from causing an infection. What happens is that the patient will urinate, it's called natural flushing, and the bacteria leaves the body. So this is they actually talk about a number of different types of products that can be used for natural prevention. However, cranberry prophylaxis was the only one that actually made the guidelines with enough evidence. This is the Canadian GP guidelines from the Mums Health Group. And they talk about the different types of antibiotics here that can be used for recurrent cystitis. But it does call out that cranberry juice cannot currently be recommended for the prevention of UTIs. There is emerging evidence that 36 milligrams of proanthocyanidins or PACs may prevent UTIs. So this is kind of where the direction is going, that, there's a lot of scrutiny. Does cranberry actually work or not? The evidence is still in favor of cranberry, but looking specifically at the active molecules called PACs for short. So that brings me over to Utiva. So Utiva as a brand in itself focuses on UTI prevention. We have a few different products. One is a 36 milligram PAC cranberry product. This is our flagship product for daily UTI prevention. We have a gummy version for kids. We also have a probiotic catered towards the urinary tract and gut health patient. D-mannose, as well as UTI test strips. So we're one of the only companies in Canada that has a home-based, like medical device approved UTI home-based test strip. Quick summary here of all the products. The UTI test strips, they test for leukocytes and nitrite, very easy to use, and you get 3 strips per box. The cranberry packs themselves, it's one capsule that provides 36 milligrams of soluble packs. It's once a day, easy to use. The probiotics also is once a day. This is a great product to use if a patient has been on antibiotics for a long time and also is experiencing side effects from the antibiotics. We have particular strains in there that address that. D-mannose is known to help specifically E. coli. It's a great option to consider with acute triggered, acute or activity triggered UTIs. The gummies are, again, just more for kids, but delivering those cranberry packs. And we also have wipes, which are personal hygiene cleansing wipes as well. A bit more into the science. So the 36 milligrams of PAC, this is one capsule once a day. From a pharmacy perspective, it'd be nice for you to know that most cranberry products have a lot of vitamin K or oxalates. In Utiva's UTI Control Cranberry, we actually removed all the vitamin K, and we only have trace amounts of oxalates. What this means is that there's going to be little to no interaction with blood thinners, and almost no impact to kidney stones. It's nice because a lot of our patients are older and maybe on other medications as well. This is available in like a 30 or 90 capsule bottle. The gummies, more for the pediatric population, but the exact same thing as the regular product. They are more expensive because gummies are more expensive to make. However, from a clinical perspective, we still recommend the capsules. This is for the young kids. The probiotics, it's actually a 30 billion CFU at time of manufacture. The nice thing about the probiotics is that it's got a unique blend of 2 strains and a special capsule that allows it to resist stomach acids. The one strain in particular is Lactobacillus rhamnosus GG. This is about 50% of the formulation. And this particular strain has evidence looking at reducing the side effects of antibiotics. D-mannose, again, we were talking about how it focuses on E. coli. It's approximately 2,000 milligrams a day. That's the recommended dose. So it's about 4 capsules a day for this. We do recommend using D-mannose and the cranberry packs separately. There is evidence, and we have a paper coming out talking about how D-mannose can actually reduce the effectiveness of the packs in the body. So we recommend taking them about two to 3 hours apart from each other. And the UTI test strips, great for patient use. A lot of patients like to know and check themselves, but it's good to go to the doctor to still get a culture. And the wipes. So just quickly going to run over here on the sciences. What the packs do, imagine the packs are these little balls here. They stick to the bacteria and the urinary tract wall, and they stop the bacteria from causing an infection. That's how they work. Most cranberry products have less than 1% pack. Same with juice, very high in sugar, but less than 1% pack. And Utiva itself is 15% packs. Our capsule is a small capsule, it's only 240 milligrams. 15% of that is 36, and that's how we get to 36 milligrams of packs per capsule. This is how it compares in size. These are actual pictures. So we have less fillers. It's a very clean formulation. Try to make it easy for the consumers or the patients that take. If you do the math, one Utiva is approximately 9 cranberry pills in pack quantity. So it would take you 9, for example, Jameson 500 milligram capsules to equate to 1 Utiva capsule worth of active molecules. Every batch we make of this product is actually sent down to Rutgers University in the US for testing. These products are actually tested to see how well they can actually stop bacteria from sticking. The main call out here is any product that is a standard cranberry product had no effect on bacteria. And I'm only showing 3 brands. I'm only showing 3 brands here, but we sent about 10 down. None of them had any effect on bacteria. The only ones that did had 36 milligrams of pack, and Utiva is the only one available in Canada. Now, this is the first time I'm kind of sharing this chart here, but we actually did a test and got all the packs measured in various different brands across Canada. As you can see in this chart here, Utiva has about 40 milligrams in this test, 39.6 milligrams of packs, whereas you can see Jameson, Natural, Weber Natural, like they're all in the very low single digits. Bottom line is, you know, on the label, we call out that we have 36 milligrams of packs measured with a specific method. No one else really calls it out. It's because most products do not have much active molecules. Long-term case study, we did a study where, 10 patients, very complex, out of a long-term care center. Most of them were on daily antibiotics before prophylactically, and then they were switched by the resident physician there to Utiva once a day. And it was a very short, small study, but what they experienced was they went from 21 UTIs 3 months prior to taking Utiva down to 7 UTIs the 3 months after. And all these patients and more now continue to take Utiva at this particular center. We've had over 20,000 patients now taking Utiva since we launched about 3.5 years ago. 96% of them would say that they have used Utiva for more than 6 months and experienced fewer UTIs. But 48% of our patients actually become repeat patients. And we launched with specialists. So majority of the people recommending Utiva are the urologists, the urogynecologists, and we've started moving into the GP space. So they're the ones who help propel and actually recommend Utiva to their patients that are getting acute or recurrent UTIs. Just examples of some academic centers that have UTIs, that recommend Utiva. The ones that people here might recognize, like UHN out in Kingston, Mount Sinai, Metrovan Urology, and we're also in the US. So there's a lot of US centers that are actually recommending Utiva as well. All right, so without further ado, I'm going to introduce Colin, who has had some great experience with Utiva and has been with us since early on. So, Colin, do you want to introduce yourself quickly?
Sure. Hey, everyone. You can hear me, Derek, right?
Yes, I can.
Okay, sounds good. So I am a pharmacist now this is my 32nd year. I'm in Vancouver, graduated in UBC, University of British Columbia in 1990. And we have an independent pharmacy located in Kerisdale area of Vancouver. It's a practice that's a lot of geriatric patients, a lot of younger families now. We've done a lot of long-term care. We've done a lot of compounding, and we do a lot of nutritional counseling and diet stuff as well. So yeah, that's kind of our story there.
Thanks, Colin. And I should let everyone know that Colin was gracious enough to spend his time with us for a bit here. He's out in sunny Hawaii right now, which I was saying earlier that he's somewhere warm, we're somewhere cold, but glad you could enjoy your time out there. And thank you.
It's pretty nice here.
So, all right. So I have a few questions for you here. And this will help kind of paint a picture for everyone that's attending as into like how Colin learned about Utiva and his experience with it. So first question, how often do you see UTI patients, and do you identify them as acute or chronic?
Yeah, we see probably, I would guesstimate at least 5 patients every day coming in for prescriptions for urinary tract acute therapy. If we'll go through their chart and see if they are repeat antibiotic users in the last 6 months or longer. If it's kind of a one-off, obviously we're going to counsel them on their antibiotic. We may or may not discuss, the Utiva product, but certainly if we see antibiotic use in the past, recent time, we definitely bring it up. It's something that we do talk about a lot.
Thanks, Colin. So great segue. How did you first learn about Utiva's UTI control supplement with the 36 milligrams of cranberry packs?
Yeah, interesting, because we had not heard about it. And one of my patients came in and she had a little note written on paper from her doctor and said, to the patient, you need to get this product called Utiva. And our patient came in and I said, well, I've never heard of that. And I looked it up and online, and that's when I ran into you guys, to Derek, and I said, I think I can get this in for the patient. And I called up Derek, we got the product in, and right off the bat, she purchased it. And a few days later, another patient came in. It was actually one of the doctors in Vancouver, one of the specialists who was recommending it. And they found out that we carried it and started sending quite a few patients our way.
Nice. What counsel would you provide them before and now? What is your best practice?
Well, we talk about the option about, like, to the patient saying, listen, there is something available that can prevent the urinary tract infection, either completely or reduce the frequencies of infection. And anytime that you can suggest something to a patient that's going to prevent them from being ill and going through, the discomfort of a UTI, and it's not very fun. People, it's painful for one, it's inconvenient. A lot of patients just feel really, really lousy when they get one and get agitated and irritated. So if we can suggest something to a patient that it's going to reduce that chances of getting these infections and also reduce the use of antibiotics. Most patients don't really want to be on an antibiotic if they don't have to. So if you offer this option, most people will listen. At the very least, they will listen to you. And I probably hit 1 out of 3 where they'll take me up on the suggestion to get something like Utiva, or they'll think about it and take the pamphlet home. And then I say, all good, just make your decision later on. If you happen to get another infection, you know that this might be the best thing for you.
Thanks for the thought and recommendation there, Colin. So, you kind of alluded to like how you heard about it, but what really helped you trust Utiva and put it to the forefront of your recommendation when these opportunities arise?
Well, I read some of the studies first and the information from Utiva. I read the studies. I sort of, certainly understand the science. And I think it was that, and then coupled with patients coming back after the first couple months of buying the product. At the beginning, we only carried the 30 pack size, the 1 month supply. And then we would see the patients, in another month, and then in another month. And we'd often ask, how are you doing? Or they would come out and say, as they're picking it up on the shelf, going, Colin, this is working. It's great, and then we, use that information to tell other patients, by the way, this is some of the things that our patients that are on it are saying to us. So consider it.
Awesome. And then I think that led to you, because I remember you didn't have the 90 capsule size at first, and then I guess it just made more sense and saves money for your customers as well.
Yeah, we were a little hesitant. We weren't really sure, how's this all going to go, right? And the 90s are, it's a bigger price point, but it is a savings to the patient. So we used to do much more 30 sales but now we are probably about, yeah, where am I here? Yeah, 2 to 1 in sales for the 90 size. So there's a lot of people that basically are return and are on it for longer term.
Do you get any questions or objections from the patients when recommending?
You get questions for sure. I mean, people are interested in stuff. You know, a lot of patients, if they don't take you up right away on trying it, we'll take the information home and maybe go online to Utiva and read it, or read the pamphlet. I think people are very interested in it. There's not a lot of objection other than just more like the think about it thing, or they might say, well, I don't get a UTI that often, so I'll think about it, that kind of thing. But I'll tell you, when you make the recommendation and a few months later they're back in with another infection, they say, what was that product again? I think I might need to get that stuff to prevent. So that's kind of what you see. But definitely people are interested, and I think they really appreciate the conversation, because a lot of people, just like I said before, they don't really want to be on antibiotics. They're kind of frustrated by that. So just offering that option, I mean, it is financially, it's a little bit of money, but it's a lot, in the long run, a lot more comfortable not getting one of these infections. So it's a good idea.
I've also seen feedback talking about just the amount of time and the hassle it is every time they get an infection. They have to go back to the doctor, then they have to get another script, they come into the pharmacy, and it's like a vicious cycle in a way. So
yes,
it's just a huge constraint on their quality of life in a way, right?
It really is.
Okay, so you know what you talked about, you've been using, so in total, like you got to remind me, how long have you been recommending Utiva for now? I think it's been a little over 2 years now in that.
Yeah, it's a hair over 2 years. It's been great. And we do a lot of sales on it, and we do talk it up a lot. The pharmacists, we all are aware of it, and basically make at least mention of the product to almost every patient, especially if they're, as I mentioned earlier, if they're a repeat antibiotic user for UTI. It's just something that we do. It's almost something like when we recommend for patients in general with antibiotics, you might consider getting a probiotic just to restore the normal gut flora and rebalance you after an antibiotic therapy. So it's just something that we do in our whole discussion with patients now.
Do you, if you do you have any specific patient stories you could call out or share with us?
Well, certainly many. With a lot of the patients who just come and to say, hey, this has really changed things for me. It's I've we have a couple patients now on it for 2 years, and many patients on it for 6 months, 12 months, that kind of thing. The response is excellent. I look at all the patients. I think I've only had really one patient where they didn't respond overly well, but that was because there was a physical condition, an underlying condition there. But other than that, really everybody has said to me there's a reduction. And I do actually have a couple men on it as well. I know it's less frequent for men to have a UTI, but I do have a couple men on it, and the comments are pretty positive as well.
It's great to hear. One of the toughest patients that we see coming our way are those with spinal injuries, and therefore they have the neurogenic bladder that's just not emptying properly, and that's a group we do try to support, these types of patients, and they're not responding to antibiotics, they're not responding to Utiva that well. But one feedback that we do get is that at least they feel a reduction in symptoms, and it's still reducing the UTIs, but hey, it's in a way for them, they're throwing everything at the wall when they're in this type of condition. So it's again, Utiva is not a cure, it's just it's an excellent option for your everyday prevention though. Given that Utiva satisfies your clinical trust and patient expectations, can you share the impact that our products are mainly one product right now, but also some of the new ones coming out, has had an impact on your OTC or front store business?
Well, I mean, hey, as a pharmacist, if you can offer a product that works and helps people, and also that you can sell, then that's just a perfect combination, right? So we're really lucky with this product. It's probably one of the top 5 single products that we sell in the store of any kind of product. Like it's done really well. We're selling at least 1 unit a day of it. The margin's very good. You know, we're somewhere 36 or 37 or 38% margin on it, which is great. We did a good job with it. We actually have a display right at one of our at the main counter for pickup of prescriptions. So when we do counseling there, the display is there. So it's nice and simple and easy. We point to it, we talk about it if we're discussing with patients. And it's also there for patients, even if they're not in the pharmacy for a UTI infection, for any reason, it piques their interest. So we did a good job with promoting it in store, talking it up a little bit. And yeah, you know, we're very excited. I mean, it's added a lot to the bottom line, I'll tell you that much.
Thanks for sharing. I'm glad, but you know, everything you said is truly in the right order. Like it's got to satisfy your clinical trust. It's got to actually be showing benefit, and then you know you have that confidence behind to actually recommend something and not just trying to upsell a customer. It's something that actually works, right?
Yeah, it's always, we always specify with the pharmacist. It's just make the patient aware of things that are available, and that's the best priority is just to do that and let them decide.
Okay. You know, that kind of last question here for you was, do you have any tips to share with other pharmacists? I can imagine there should be quite a few in our talk right now that also carry Utiva. And I guess the tips are in terms of, you know, being a bit more proactive, because it's not a product that can sell on its own often. There is some educational component behind it. Right. Any tips that you can share with anyone else that carries it?
Well, I think, you know, make your main people aware of it. Obviously, your pharmacists. Make the suggestion to them to suggest to patients, especially if they're candidates. It doesn't have to be every patient, but and not every patient really would be a candidate. But let them know that this is to help patients, really. And in making the suggestion, you are helping the patient. If you're not making the suggestion, you might not be fully helping the patient as much as you could be. So that's a good thing. I also liken it to, you know, years ago, like with the probiotic stuff. I mean, years ago, probiotics were a little bit kind of airy-fairy. Nobody really knew much about it and anything. Now it's pretty much a household name in with patients. They all kind of have heard about something like that, or most of them have. And we've been comfortable recommending those things for years and years and years. Now it's just part of the conversation, as is with Utiva, and that's a good thing. And I think even with anything in your pharmacy, if you see a patient in pain for something, you're going to, you know, maybe make a suggestion or recommendation. This is the same kind of an idea here. It's you know, I think it just becomes part of your practice, and that's why I like this product a lot. And I have other products that are go-to for other conditions. But yeah, make them aware, make the patient aware that there is something.
Awesome. Hey, Colin, I appreciate you taking your time especially out of your vacation to join us for this talk. I believe there are some questions for us, but what I'm going to do is I'm going to stop the screen share and I'm going to see what questions that we have, and then we can wrap up from there. Give me 1 second here. Okay, so here's a first question, and we can split them up based on, we'll see how they go here. But the first question is, could you show the chart about comparison of packs with other companies that would help inform patients the superiority of Utiva? Okay, so that's on me. So what I can do is I will come back right at the end of the talk, because we're not doing the screen share right now, and I will show that slide again that shows the pack comparison for the various products. So is your product comparative to the American product Elura cranberry capsule of 36 milligrams? So that's a great question. That product's been around for a while. Colin, I'm going to ask you, had you heard of Elura at all in the past?
Yeah, same thing. I had not. The patient came in, and then the doctor wrote out Elura name and Utiva. The patient actually thought she was supposed to take both. And when I looked it up and I realized it's kind of the same thing, I said, I think your doctor is referring to one or the other, but I said I only carry Utiva. I don't even know, is Elura available in Canada? I don't even know.
So, okay, so I'll just touch base on that. It's a great, thanks for that input. So Elura is the exact same thing. It's a 36 milligrams of soluble pack formulation. It's an American company. The product is actually made overseas in Europe, I think, and it's imported into the US. They've been around for a long time. They are very expensive though. So they're much more expensive than Utiva, and they sell in American dollars. A lot of the urologists here in Canada were recommending Elura before we launched. Patients would have to typically order it in from Amazon, pay shipping, pay duties. But, you know, if our product, for example, is 100 Canadian for 90 capsules, their product was 120 US for the same size, plus shipping, plus duties. So the cost to the patient was considerably more. Canada didn't have an option. And that's where we came in to create a product that was equal in efficacy and locally made. So our product is made actually out in Trois-Rivières in Quebec. So it's 100% Canadian. We have Canadian cranberries, Canadian made product. So we're proud to say we're a Canadian brand, and we hope that everyone can support Utiva. But great, it's a great question. Next question is D-Manos part. Could you go over that again? I can briefly touch on D-Manos. Colin, are you familiar with D-Manos at all?
Yeah, we've carried D-Manos powder in the pharmacy for quite a few years now by another company, by Douglas Labs. I'm kind of happy to see Utiva doing it now, and I will bring it in when I'm back. But yeah, there is some good literature on it for preventing UTI based on E. coli cause of UTI. So there is some good data on that.
Exactly. So you hit it bang on the head, and D-Manos is known. It's known to help prevent UTIs, but specifically E. coli. When you get into your postmenopausal type of patient, there's a variety of different types of causes of bacteria, variety of bacteria that cause the infections. So D-Manos is often looked at as an acute solution for trigger associated UTIs. It didn't, like I said earlier, it didn't have enough evidence to make the guidelines, but the way D-Manos works is that it also binds to the bacteria to stop it from sticking. Is just, you know what, there's not enough studies there for the urology associations to actually recommend it, but it is recognized as a product that works. And Utiva does have a D-Manos option in capsules. So they're 500 milligram capsules. Again, the best and simplest product you can have for UTI prevention, though, is our UTI control. This one here, the packs with the 36 milligrams of packs. It's a simple small capsule once a day. Okay, so next question, is this available through distributors such as KNF or McKesson, or is it only direct through the company website? So Utiva is available on McKesson, only the 30 capsule size, the probiotic, and the test strips. The 90 capsules not there yet. It was pretty expensive, so I think they weren't ready they didn't know how well it would move, so they didn't carry the 90 capsule. But if you are interested in certain products, you can reach out directly to us. We supply, Utiva's probably in well over 2,000 stores now across Canada. So we do ship direct to quite a few of them. A lot of them also have their own kind of distribution as well. But if you're McKesson, or you can come direct. And just to let everyone know, you know, if everyone's going to order from here from the first time, we can offer like a first order promotion as well. So I've been ordering Utiva in the 30 pack size from McKesson, but can't get the 90. Okay, so I kind of answered that. The 90 is not available there yet, but hopefully it will be. And if not, you can get it from us directly. Yeah, so definitely reach out to us direct. Our minimum charge for shipping is pretty low. If you're going to order some 90s, you're not going to pay for shipping. So are you doing any studies on the probiotic product? I'd like to see it listed in probioticchart.ca. That's a great suggestion. The first time I'm seeing probioticchart.ca. We are open to doing studies. We are doing, actually, we're in talks with Sick Kids Hospital in Toronto to do a pretty large study in AHS, so Alberta Health Sciences. We are doing a study for post-gynecological study, a study with post-gyne patients to see how Utiva does preventing UTIs versus an antibiotic after gynecological surgery. So that's currently ongoing. But with the probiotic, nothing specific. I should let everyone know that we didn't launch a probiotic to compete with like the 10,000 other probiotic brands out there. What we have is a specific formulation catered more towards this type of urinary tract health patient looking to overcome antibiotic side effects and restore gut flora. And you're coming in under a trusted brand, and this product is also made in Quebec, so it's 100% local Canadian product as well. And the last question here is, oh, so that was a repeat from before. So I can go back into the screen share and share that chart. Before I do that though, I just want to say thank you to Colin for joining us again. I really appreciate you taking some time out of your vacation. And if you, and you know what, I was just going to say, we can jump into sharing the chart and then doing the raffle. And you know, you're welcome to stay or leave and enjoy the sunny weather.
I will bid you farewell. And I think we got yoga on the agenda for the afternoon. So all the best, and thanks for having me on, Derek.
Thanks for your time, Colin. Appreciate it.
Okay, cheers, mate.